You know, many of us strive to live healthier lives, but then we struggle with the ways to do it in a healthy manner. Well, you may recall here in the past we've had on the show Suzanne Summers talking about bioidentical hormone replacement therapy with Dr. Victor Bazone and John Bazone. So we brought them back on. Suzanne's not here today. She couldn't make it. But we're going to talk about something brand new. Good to have you gentlemen back on the show again.
Good to be back.
The hormone replacement therapy, I know that has done well for y'all. Your practice has evolved from that. I mean, that's a big thing with the past several years. But there's so much more going on with you. You moved to a brand new location on Lorraine Road, and I mean, of course, you've done the bioidentical hormone replacement therapy, anti-aging, and everything. But there's so many different things that is going on, and that you're bringing out for people to find out about.
Yes, as a matter of fact, we've sort of taken the practice to a new level. As you know, we've been involved primarily with hormone replacement therapy for the last 5.5, 6 years. But we have now a new technology available to us, which enables us to really test the brain for its function and to pinpoint areas of the brain which are not functioning properly or at its most efficient rate, and finding out what is wrong and what is needed in that area of the brain in order to promote good brain function. And this is a process, a technology called Evoke.
Evoke.
Yes.
Now, John, the Evoke thing, a lot of people think that this is something maybe for older people, but it's not true. There could be some other issues. I mean, you're talking about mapping out things, or finding out some problems with the brain that through proper, and natural ways to take care of it. But it could be young people as well.
Jim, you're spot on. It opens up a whole new scope for proactive health for our patients and for the people that are out there in the audience today. And the reason for that is if you traditionally worked with us on things like sleep problems in the evening, maybe dizziness, night sweats, things that are more hormone related, we were able to work with you on that. And then we also work with you on the next step to your therapy, which would be supplementation and the other things that went along with that. Mm-hmm. With Evoke, it allows us to take what would normally take an annual physical type of environment where you go through a lot of testing, and typically you don't get results and all the results back for a 6 to 9 month period, where we can do this with Evoke in a matter of 48 hours.
Wow.
And what it does is, if you've played college ball before or high school ball, you may have concerned about concussion at one time. You might have some memory issues or memory concerns. For that matter, even if you have things that run in your family like dementia, Alzheimer's, Parkinson's, cognitive type of events that you might be concerned about, you should definitely look at Evoke type testing.
Okay. Dr. Bazone, let me ask you, let's say I'm a new patient and I want to come in and find out, if I have any situations up there, which a lot of people probably would tell you I do.
We've heard that.
Yeah, exactly. But take me through the steps as to what you do with the Evoke program, if you would.
Well, before that even takes place, what we're going to get you squared away with is just exactly what your hormone requirements are, because that's a good basic foundation. And then we're going to take you into the Evoke situation. The Evoke situation, that is the testing, involves brainwave testing. It involves your response to a specific problem which we pose to you, and it also involves checking out how your heart is doing during all this.
So you're talking about EKGs?
Yes.
Doing EKGs?
Brainwave testing,
I guess
EEG.
with that you put a cute little cap or something on.
Actually, it's a skull cap.
Skull
it's cloth. It has electrodes over it. It looks like Frankenstein type of apparatus.
Okay.
But it's applied directly.
It would probably fit me real well, so.
We have one for you, by the way.
Okay.
So anyway, you have this helmet, so to speak, that
Sure.
you're wearing, and it's recording your brainwave function and how the brain reacts to the particular problem which we're giving you to solve.
So you give them problems that they're on a screen or something like that, is how they react to it?
Yes.
It
It's
exactly
called
maps it.
cognitive function.
Okay.
Yes. And so all this information is integrated. It gives us a brain map picture. And this brain map picture gives us the areas which are working properly, improperly, and what the improper areas need in order to become properly functioning. It's very simply explained, but that's what it is.
Now, once you find out these issues, whether as far as that, what's the next step? I mean, you just don't say, okay, here's your problem, go have a good life. So would you? I mean, there's so much more to it, isn't there?
Well, let me just interject.
Sure. Go ahead.
The next step is really to treat you for these problems.
Sure.
We're just not observers, we are treaters, okay? So we get the information from the brain map, we see what area is not working properly, what these areas require with respect to additional hormones, vitamin supplementation, nutritional supplementation, et cetera. And we provide this, and we monitor you as you're going through all this, and perhaps even repeat the Evoke testing several months down the line to see how you are responding.
So what you're really looking at doing is helping people improve their quality of life, and especially the older that they get. I mean, because things change. The older that we get, that we just don't react as quickly. Of course, I have to say this 102-year-old guy you might have seen on TV recently became the oldest guy to skydive out of a plane. So it's great that you can lead an active life further on into life.
Yeah.
But I mean, you might have to make some changes.
Jim, two great examples. One is we had an Evoke patient come in, and she thought she was going into rapid decline with dementia. Taking the appropriate meds for that. She had an Evoke test. Once we had the Evoke test, what the Evoke test showed in a very short period of time was that she was in severe depression. So
Wow.
she ended up with depression medicine, and from there on, it was more of a gradual recovery on that. So that's a great example of what it does. The other thing it does for a patient that may want to come in and just get that background on the history, as you said, they're interested in health overall. So what it does is, as a result, or one of the outcomes of Evoke, is it will give us a result of how your body, how your brain uses, as an example, supplements. So you might ask, how many supplements do you take? And what this does is it gives you a readout on what your brain actually uses with those supplements. So you may say, well, I take 8 supplements, and here's what my blood test shows. But what Evoke may show is you really only need these, because these are the ones that the brain is going to use.
Oh, that's awesome. Well, thank y'all so much, John.
Good seeing you
Doc,
again, Jim.
appreciate you. Good to see you again. If you'd like some more information about this, the phone number is on your screen. You can give them a call. And also, you can go to the website, make an appointment. And again, remind you that they are at a brand new location on Lorraine Road.
Yes.
But Doctor's Care, BHRT, you want to get your brain going right and healthy for your whole body, give them a call.